And with that, let me turn it over to Dr. Walensky.
Thank you, Jeff, and good morning, everyone. I want to start today by reiterating with an update of our vaccination efforts. We are now vaccinating close to 3 million people a day. Nearly 40% of all adults in the United States have received at least one dose of the vaccine, and more than 1 in 5 adults is now fully vaccinated. It is truly inspiring for me to see many Americans embracing vaccination. We know that the massive scale-up of vaccination is the key to protecting the American people and to inching us closer to our regular lives. As more people get vaccinated, we at CDC have the responsibility to provide you with science-based recommendations on the activities that can safely resume. In early March, CDC issued its initial guidance on what activities are safer for fully vaccinated people. And remember, fully vaccinated is defined as 2 weeks after receiving the single dose vaccine or 2 weeks after receiving the second dose of the 2-dose vaccines. When we released the guidance in early March, I emphasized that the science and evidence were rapidly evolving and that we would update our guidance as new evidence emerged. We now have several newly released studies documenting the real-world effectiveness of COVID-19 vaccines. So today, we are releasing an update to our guidance for fully vaccinated people. Specifically, the new guidance today speaks to travel. We state that fully vaccinated people can resume travel at low risk to themselves. For domestic travel, fully vaccinated people do not need to get a COVID-19 test before or after travel and do not need to self-quarantine after travel. For example, fully vaccinated grandparents can fly to visit their healthy grandkids without getting a COVID-19 test or self-quarantining, provided they follow the other recommended prevention measures while traveling. For international travel, fully vaccinated people do not need to get a COVID-19 test before they leave the United States unless it is required by their international destination. However, fully vaccinated people should get tested and have a negative test result before they board an international flight back into the United States, but they do not need to quarantine when they arrive here. However, fully vaccinated people who do international travel should still be tested 3 to 5 days after arrival in the United States on an international flight. Our guidance reiterates that all travelers, regardless of vaccination status, should continue to wear masks on planes, buses, trains, and other forms of public transportation while traveling. As I mentioned previously, the science on COVID-19 is constantly evolving. We will continue to monitor the evidence and provide updates as we learn more. With so many people still unvaccinated, it is important that everyone, regardless of vaccination status, continue to take prevention measures in public and adhere to our guidance on ways to reduce the spread of COVID-19. Wear a mask, physically distant, avoid crowds and poorly ventilated areas, and wash your hands frequently. And while we believe that fully vaccinated people can travel at low risk to themselves, CDC is not recommending travel at this time due to the rising number of cases. Before I close, I want to provide a brief overview of the state of the pandemic. CDC's most recent data show the 7-day average of new cases is now slightly above 62,000 cases per day, a continued increase over the 7-day period. Similar to cases, new hospitalizations continue to increase, with the most recent 7-day average at nearly 4,950 admissions per day. The 7-day average of deaths is slightly below 900 deaths per day. These data continue to be clear. Despite the good news on the vaccination front, we simply cannot yet afford to relax the prevention strategies. We must continue the practice of mitigation strategies we know work, like wearing a mask and physical distancing, in order to slow the spread of COVID-19 and to see the end of this pandemic. This is a pivotal moment for our country. As I said before, we are taking unprecedented actions to vaccinate the public as quickly as possible, and millions are being vaccinated each and every day. We are better equipped than ever before to take on these serious challenges, but we must remain vigilant. Finally, I want to briefly follow up on a question I received on Wednesday from Sikan Akpan at New York Public Radio about the B.1.526 variant and its classification as a variant of interest rather than a variant of concern. I want to be clear that listing a variant as one of interest rather than a variant of concern does not mean we are not prioritizing the variant or that the variant is not important for us to carefully follow. Rather, it means that we are still working to understand the variant, gather data on it, and determine its impact on medical therapies, disease severity, and transmissibility. As we are better able to characterize the variant, its classification may change based on those findings. In the case of B.1.526, the one most recently found frequently in New York, we continue to assess its prevalence regionally and nationally, its transmissibility, and to conduct studies to understand how its mutations, for example, its E484K substitution, impact therapeutic and antibody responses. Until those assessments are complete, it will remain a carefully followed variant of interest. I want to acknowledge today that providing guidance in the midst of a changing pandemic and its changing science is complex. On the one hand, we are telling you we are worried about rising cases, to wear a mask, and to avoid travel. Yet on the other hand, we are saying that if you are vaccinated, evolving data suggests that traveling is likely lower risk. The science shows us that getting fully vaccinated allows you to do more things safely, and it's important for us to provide that guidance, even in the context of rising cases. At the same time, we must balance this guidance with the fact that most Americans are not yet fully vaccinated, which is likely contributing to our rising cases. And that means we have to continue to reinforce messages about the critical importance of COVID-19 prevention measures. We all want to return to the things we love, getting more people vaccinated as quickly as possible and taking prevention measures to stop the spread of COVID-19 is the path out of this pandemic and back to our everyday activities. To help the public understand what actions to take depending on their vaccination status, we have placed updated information for consumers on the CDC.gov website.